The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
All right. Welcome, folks. Thanks for joining us on the Predictive Health Clinic. I am joined today by Doug Reynolds, who is the founder of Low Carb USA. If you don't know about it, you should know about it. But Doug, I don't think we're actually going to talk about Low Carb USA today, are we? What's the one health topic you want to address in this episode?
I think to expand on what you just said, I'm also the president of the SMHP, the Society of Metabolic Health
Practitioners. Oh, that's right. You are. I forgot that.
And that kind of spawned it from Low Carb USA and has just taken on a life of its own. So it's a combination of something that happened in our focus day in the Boca Raton event in January, and a lot of what's been going on in the SMHP, all around type 1 diabetes. Because when you said to me you want like one topic, it was like, but we talk about everything, right? So how pick one? But then it suddenly occurred to me how important this was right now. And that's kind of why I've chosen to focus on that for this talk.
Okay, question two is why'd you get interested in that particular issue?
So it started with, we've been having these focus days in our conferences, like the first day focuses on one particular condition. And we did cancer and food addiction. And in January this year, we did one on type 1 diabetes. And it was suggested to me as let's do that like last year. And I kind of flippantly just said, oh, why not? Let's do it. But we ended up with a subcommittee of folks that helped us plan that day. And through that planning and through that weekend of the conference, I actually did a podcast the other day. It changed my life. And I think what most of us don't appreciate is what these type 1 diabetics go through on a minute by minute basis, not even on a daily basis.
Yeah.
One of the guys described it to me as like having this parallel pathway going on in your life 24/7. Where you're making your normal life and all the decisions and stuff that goes on there. But in parallel, you've got this thing where your condition, your status can change at any second. And so you're making all these decisions on an ongoing basis all the time, and even have alarms going off to try and warn you when stuff's going on when you're sleeping.
Yeah.
And it just had such an impact on me that whole weekend, and how much it meant to the type 1 diabetes community, because they have been ostracized and ignored. And a lot of the people that are the leaders in their community are not even doctors. They are rocket scientists and other people with other jobs whose kids have developed type 1 diabetes. Right. And they've had to learn how to manage this on their own because the doctors won't and can't help them, because they're not taught about this, and many are afraid of it.
Yeah. And
so we had this day, and we had a workshop the day before, which was more a lot of practical stuff. And one of our long-term attendees, it comes to most of our events, he's actually retired now, and he got up to the mic during the Q&A and he said, I learned more this afternoon than I have in my training and throughout my entire career on type 1 diabetes. It was incredible. And I had doctors come up to me all through the weekend saying, this is the most amazing thing. I actually feel now, because what happens is that if someone comes in and they present with type 1, they actually just ship them off to somebody else because they didn't have the confidence to be able to manage them and help treat them. And learning how to do that through this therapeutic carbohydrate reduction, and how much easier and safer it makes makes it for people to be able to manage this themselves or to manage their children was just such an eye-opening experience for all of us, but it's, especially for all the doctors and the physicians that were there. It was.
So who should we be talking to right now? Are we talking to the type 1 diabetics, their families, or the physicians who are treating them? Or is this...
I think both, because there's the patient who needs help and is not able to find good help, and the prevailing treatment protocol is to eat a bunch of carbs and just calculate what your dosage on your insulin must be, and it's all about just take a bolus for whatever it is that you're eating, and you'll be fine. And that's completely not true. One of the things.
All right, hold on. So
yes.
This leads us to questions 3 and 4, which is about misconceptions and truth. What's the biggest common misconception that both doctors and patients deal with?
Yes, I think that's probably it. It's the fact that most doctors have been taught, and that's what they prescribe to their patients, is just calculate what insulin dose you need to take for whatever it is that you're eating during meals and etc. But what the guy explained to me the other day was that insulin is every single time you get every batch of insulin, and even probably vials within that batch, are different. And depending on how the temperature they've been exposed to, how long they've been there, or the manufacturing process, all sorts of things, the same type of insulin that's supposed to be exactly the same has vastly different responses for a particular person. I heard the other day of someone where she literally almost died because she was taking insulin and it was like water. It literally had zero effect on her. And then she'd been using that same insulin for years. But this one batch that she got was ineffective, and so she almost died. And I think what we are teaching people is that if you take carbohydrates and sugar out of the diet, then your roller coaster becomes this like little bumpy road, and these huge spikes, and now you got to dose insulin to bring that down, and then you take too much and you go hypo, and that's when it's really dangerous, is when you go very low. And doctors are actually talking about having a target A1C for a type 1 diabetic of 7.1 or 7.5 or something.
Even I know that's
insane. High. But they do that because they want to err on the side of caution so that they don't go low, because the low is where they can die. But now you find these folks in this community that are now using carbohydrate reduction as a backbone to their entire philosophy. They find that suddenly they're not having this roller coaster anymore, and that they can go on to slower acting, much smaller doses of slower acting insulin. And so they are not at risk of going low while they're sleeping and having to have alarms to try and wake them up to say, hey, you're going to die. They don't need to do that anymore. But they are being ignored by the medical community. And so they actually get quite aggressive and combative. And I almost was a bit turned off by them in the past because of that. But having gone through that weekend and the planning beforehand as well, I finally understood why it is that they are like that.
Yeah,
I had people staying, one of the doctors that we brought out from the UK to be one of the speakers there, Ian Lake. And as I walked into the foyer, and he'd just arrived, and I got a message that he had arrived, went down to meet him, and he put his arms out like this, and he said, Doug, is this really happening? That we're going to have a whole day focused on type 1 diabetes and how to safely treat it or manage it. You don't treat, but manage it. It was, yeah, I have really felt as good, I suppose, like, for lack of a better word, about anything that I've done before. Then because of right in front of me, I could see the impact that it was going to have on this community. And we normally have our videos behind a paywall, And I put all the videos from that day and the workshop before on YouTube for free for them to be able to. And I spoke to someone like on the podcast 2 days ago, and he was saying that they send that stuff out like all the time to people as people are coming into the community and asking for help because they've got kids newly diagnosed with this, and like they are besides themselves because everybody's just telling them that that the kids' life is going to be shorter and chances are they're going to die, and that's a very real thing.
Let's do this, and I'm glad we were here. You and I are immersed in the world of therapeutic ketogenesis, low carb. You for a lot longer than me, but I've been in it for 3 years. And so I've kind of heard most of this, but there are going to be people, both physicians and people with type 1 diabetes in their life, to whom this is brand new. So let's get very specific. And I want to try to keep it tight and short, but the conventional treatment is you're eating your food. You got to calculate what your carb load is. That's going to help you calculate how much insulin you need to take and when you need to take it. And there's also this variable where sleep and exercise and stress can affect the calculation. And there's also the variable that I'd never heard about where the insulin itself is not identical vial to vial, batch to batch. We'd like to think it is, but it's not. And so that makes it all more calculated. That's the conventional treatment. I want to call it revolutionary, but it's really not. It's just the better way is now break it down for me. What does it mean to do carbohydrate restriction? What's that practically look like for a type 1 diabetic?
So basically, if you're looking at a typical keto, they talk about maybe 50 grams or something is what you should be targeting. And that works for a lot of people. But for them, for therapeutic things, you're looking to keep it below 25 grams.
Total grams of carbohydrates in a single.
Oh, yeah. And they're looking at total grams, not, there's a lot of people that they say, okay, we'll take the fiber out and that. But especially when you're talking about therapeutic uses, then the physicians that do this like to use a total carb count to keep track of that. And yeah, I mean, it's really just that. You need to work out for your lifestyle and whatever your body type and whatever, what the ultimate amount of protein is that you should be targeting, and you try and make sure you get in that much. And I've heard it described as use fat as the lever or the lever, right? Where that makes up the difference in your calorie requirements. And we're not talking about restricting calories at all. In fact, we try to encourage people not to do that because that can lead to other problems. And so you make up the balance of your calorie requirement with fatty, the fat and the meat and the fish oils and the other things, healthy fats that you can introduce into your diet to induce satiety. And because you're doing that, you don't get hungry, you're not scarfing down a whole lot of stuff, don't have these crazy roller coaster type blood sugar swings. The person I was talking to a couple of days ago, their son is now 18. He's 6'4". He's on a provincial like swimming team. One of the other guys that's involved in that community, he's also about the same height as well. He's playing not professional, but he's playing like high level football and stuff. These people are functioning athletes in society, and they are doing that in spite of the fact that they are dealing with type 1 diabetes on an ongoing basis, just because of they're adopting this lifestyle and this way of managing their issue.
All right, I'm going to dig a little deeper than we would normally do. Often, the next question typically is, what's the likely outcome if folks don't take action? But type 1 diabetics know that. So let's go a little deeper. There's an awful lot of resistance to the type of diet that you're describing, where you're severely limiting carbohydrate intake for, you're saying 25 grams of total carbs every day. And that means that you're getting all the rest of your calories from fats and proteins. The typical person who isn't aware of this is saying, that's crazy.
Yeah.
Address the person who's not really up to date on the latest thinking on these severely carbohydrate restricted diets.
So what the real bottom line is that of all of the three macros, you've got fat and protein and glucose, basically. There is zero requirement for carbohydrates or sugar in your diet at all. Your liver, through gluconeogenesis, is able to produce glucose in your bloodstream, and it produces everything that it needs and nothing more in a properly functioning system, right? And that the only two macros that you have to have is fat and protein. And so many people are unaware of that, and they don't realize that there is zero requirement for sugar or carbohydrates in your diet. Zero. And a lot of people, Rob Sivers is a big one, and he doesn't prescribe under 25 grams. He prescribes zero. But he acknowledges that there will be some creep. And so if you're eating vegetables, you're eating all the low starch, spinach and broccoli and cauliflower and stuff like that. And those all have little bits of carbohydrates in. And those kind of tally up. And he knows that if you're going to eat right, you are going to be under 25 grams. And so he doesn't even get his patients to even calculate it.
Okay,
Just make sure that they target the right types of foods that have very low carbohydrates in them. And he said, he's got a lot of full carnivore patients as well, where they choose not to eat vegetables at all.
Yeah, that's what I'm hearing. So if I was told, hey, you need to not have any carbohydrates. So I'm thinking, what's left? And to me, that's meat, that's eggs, that's dairy. So a very common
fish,
complaint is
chicken. I mean, yeah. I mean, we say meat. I suppose fish and chicken kind of qualify as that
I think
well.
of meat as the muscles of an animal. A very common pushback is, aren't you going to suffer serious constipation? Doesn't your body need the fiber?
Okay, so now you're going down a rabbit hole. But the fact is that when you really look at it, it actually does not need fiber, and quite the opposite. That fiber actually causes more problems than it solves. It doesn't really have a role. I mean, we don't, because fiber needs to be fermented in your stomach, and we don't have the mechanisms like other animals that eat plants, where they've got this mechanisms within their digestive system that can ferment this fiber down to something and produce. And what it actually does is use fat at the end of the day a lot of the time. And so for them to then utilize in their bodies for what they need, we don't have that. And the body tries to do. That's why you get a lot of gas and stuff like that you eat a lot of vegetables, and that it can be pretty hectic. And the carnivores have zero fiber and function. I mean, there's guys and girls that function at very high level. I mean, Dr. Shawn Baker is one example. That he's huge, massive guy, and he eats just meat, and he eats eggs and other stuff as well. But he tells me when he's training for an event, he eats just steak. That's it, because he finds that is the most effective for him to get to his best. He does these like rowing competitions and stuff like that. It's insane. And there's no fiber, there's no requirement for fiber. Your body doesn't need fiber, the same as it doesn't need carbohydrates. We've just been told this over the years, and it's become de facto medical knowledge that you have to have fiber and you have to have carbohydrates in your diet. And it's just rubbish.
All right. We're going to provide lots of resources for folks in the show notes here, but I want to keep it. We made a promise that we're going to go 20 minutes, and I think we're already over that. So
Okay.
let's go to the last couple of questions. Common complaints, common compliments in your work. What's one of the most common complaints that you hear with your work?
With what I do or with what we teach?
What you're teaching.
I can't do without my bread. Or yeah, he has some of the most lame excuses out there. But I have come to appreciate the fact that most people are on the spectrum somewhere of food and carbohydrate addiction, and that I have become more tolerant of the fact that people need to,
Let's look at the positive side. What's one of the more common compliments that you get?
Sounds kitsch, but like, you saved my life, or you changed my life, over and over and over again.
So the downside is, no, I need my bread. And the upside is, you saved my life.
Yeah.
I think there's a
And you know, I know you have
bias
questions
toward
in that you try and get through, but there's something very important that we must get to here, and that is, when I was talking about the Society of Metabolic Health practitioners, on our board of directors is a guy, Dr. Kalajian. A lot of people know him from his podcast.
Yep.
But he has worked like a Trojan to produce a consensus paper, a position statement on type 1 diabetes, basically as a guideline to physicians and practitioners who are trying to help treat their patients using this protocol. And we've had so many people involved in it from throughout the type 1 diabetes community, doctors and scientists and amazing people, and it literally got submitted the other day for publication. So it's in review at the moment. And when that comes out, that's going to be a crowning achievement of the SMHP. We plan to have a whole lot more going forward, but this is the first. And it's an incredible bit of work. And I have to give kudos to Kalajian for the amount of work that he put in that to actually make it happen.
Yeah, I think we're going to have him on the show later in the year as well.
Oh, cool.
All right. This is my favorite question. If you could deliver just one message about health and you had no more than 8 words, what would that message be?
Follow the science and make your own decision.
Follow the science and make your own decisions. That's a good one. That's a good one. All right. Doug Reynolds, founder of Low Carb USA and the Society of Metabolic Health Practitioners. Thanks for being with us today on the Predictive Health Clinic. We're going to have lots and lots of links to the things Doug either specifically referenced or implied in the show notes. Check those out. Share this episode with your friends. Thanks for being with us. We'll talk to you next time.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.